Welcome to the body imaging cases. This young lady presented with vomiting and abdominal pain for 1 day. She had history of gastric balloon insertion 11 months before. The abdominal X-ray shows 2 gastric balloons in place and shows also dilated small intestine and collapsed colon, quite suggestive of mechanical intestinal obstruction. In this clinical scenario of intestinal obstruction in a patient with gastric balloon insertion, the possibility of gastric balloon migration is an important consideration. To explore this possibility, we need to do 2 things. We need to search the X-ray for the metallic part of the balloon. And here we have a perfect example of this metallic part in the 2 intragastric balloons. We need also to ask the patient how many balloons have been inserted. A metallic structure exactly similar to those of the gastric balloons is seen lower down in the abdomen. This is a magnified view of it, denoting migration of a 3rd gastric balloon as the cause of intestinal obstruction. On asking the patient, she admitted having 3 balloons inserted. CT has been performed to know if there is perforation as well. This is the metallic part of one of the gastric balloons, and this is the second. This is the small intestinal obstruction, evident by dilatation of the small intestine and collapse of the colon. And this is the collapsed and migrated balloon. This is free fluid in the pelvic peritoneal recesses. It may denote perforation, but the presence of extraluminal gas gives more confidence to the diagnosis of perforation. See how the amount of extraluminal gas is very small and how it may be useful to change the window level and the window width to be sure that this is gas. Laparoscopic balloon extraction through the ileal perforation was done. The perforation was closed and peritoneal lavage and the drainage were performed. The other 2 gastric balloons have been removed. And the final diagnosis is intestinal obstruction and perforation due to migration of a gastric balloon. The learning points are: in case of patients with gastric balloon and intestinal obstruction, balloon migration is an important diagnostic consideration. Inquire about the number of balloons inserted and search the X-ray for the metallic part of the missed migrated balloon. CT is needed for the assessment of possible bowel perforation. In cases of bowel perforation due to balloon migration, the amount of extraluminal gas may be very small. Manipulation of the window level and width may be needed for detection of the extraluminal gas.